bodies bring up traumatic memories in a way that feels like it's happening all over again. So you have a hard time recognizing that when that cue happens and the memory's pulled up, that you're actually safe. You're not going through it again. Your body doesn't really discriminate that well. A lot of people have a hard time really being fully honest with their therapist because sometimes you just want to do a good job. You want to, show that you're trying hard. I think that there's often a fear of opening the floodgates and suddenly you're more of a wreck than you were before because you just can't pull things back together and you're completely unraveled. The process of doing this is also, again, going to serve as an exposure exercise so that you're not running from your anxiety and you're going to start building self-efficacy, that you can see yourself as somebody who gets stuff done, even in the context of a place that makes you feel a lot of mixed feelings. That's a lot. And you're not doing anything wrong by struggling. It's so much, and I'm sorry that you have to be in this situation. I think anybody would be in a tough spot if they were in your shoes. All right, hello friends. This is the Hardcore Self-Help Podcast. I'm your host, Dr. Robert Duff, and today I have a question and answer episode. Two really good questions. They both have a bit to do with trauma. In the first one, I do mention something about a sexual assault. There's nothing graphic, there's no descriptions, but the topic does come up, so just want to make you aware of that. But two really great questions. I also would like to ask you for questions. I've put out the call recently, and there's been a little trickle of questions, but I could really use more. The amount of questions I've been getting has definitely gone down, and I'm sure that has a lot to do with the fact that I've kind of changed the focus of the podcast to being more half and half with the question and answer and the interviews, which have been going great, but I do need more questions. So if you have a question for me, send me an email to duffthepsych@gmail.com. Alternatively, you could just go to my website, duffthepsych.com, use the contact form there. And if you don't want to do those things, I can also check out the comments on YouTube. So if you want to leave a comment on this video with something you have a question about, that's great. You can shoot me a message on Instagram or any social media. All of those work. Email's the best if you want to give a little bit of backstory and I can kind of keep it categorized. But yeah, give me your questions about anything, life, relationships, mental health, psychiatry, neurology, anything like that, and I can try to give you a good answer. But yeah, like I said, for this episode, we have two questions, and I'll go ahead and dive into the first one. All right, so first question reads, Hi, Dr. Duff. I think your podcast is incredible and has helped me immeasurably. I have every episode saved and periodically go back to certain episodes when I have trouble. My question is about PTSD. I'm 40 years old and own and live in a house that is essentially a PTSD trigger. I inherited it after caring for my grandparents who both had cancer and I was raped there. I feel like I can't think while I'm at home or I absolutely fall apart. The home has hurricane damage and is in a horrible state, but I can't seem to fix anything. I can't even have anybody over. I have panic attacks if somebody knocks on the door. I barely even leave my bedroom, which I grew up in. How do I get the courage to directly address this trauma, sell the property, and move on with my life? I feel completely stuck. I know I won't ever be anything approaching happy as long as I live here, and I feel like I cannot start my life until I move on or away. I've repressed and avoided these thoughts and emotions for decades, and now that I've acknowledged it, I'm a bit of an emotional wreck. Obviously, I need to attend therapy and talk about it, but I didn't even tell my therapist how severe this problem is. I made a friend that felt safe and I told her I feel seen and understood for the first time, but it really fucking hurts to think about. I've been crying to sleep and upon waking. Thanks for all you do. Thank you for that question. I really appreciate the kind words about the podcast and I'm glad that it's helped you out. And wow, what a situation to be in. That is so difficult. I think this is a great example of the saying goes something like, you can't heal in the environment that's hurting you. Very much applies to you right now. This is a really, really tough situation. So you were caring for your grandparents in this house, which is the same house that you were sexually abused in. And you were caring for them presumably until they passed away. I'm not sure how long that process was, but I can't imagine what that was like for you. Clearly that home holds a lot of history, and I'm not sure what your feelings about the home in general are, if you feel just negatively toward it, if it's a mixed bag, but inevitably you're going to have a lot of different memories that are attached to it. And I don't blame you at all for feeling like it's all just one big trauma trigger in its own right. The way our memories work is, at least partially, through association, which means our mind pairs things together. And that's why we're really good at calling up information. If you try to think of the name of a movie or, the person that was in a movie, you might not be able to pull it up. But if you think about the details around it, like where it took place, what the music was, things like that, that can trigger you and you can pull up that information. You have that association. And that's great, but it's also one of the reasons that trauma can be brought back up to the surface with certain cues. Our bodies bring up traumatic memories in a way that feels like it's happening all over again. So you have a hard time recognizing that when that cue happens and the memory's pulled up, that you're actually safe. You're not going through it again. Your body doesn't really discriminate that well. And that's one of the reasons that trauma is so difficult to deal with, because it's not just a bad memory like other people have. And trauma itself is not the event that happened, it's how your body's reacted to it. Because certainly some people can go through horrific things and they don't like thinking about it. Potentially it's a bad memory, but it doesn't have that same triggering quality. It doesn't make them feel like they're going through it again. For you, you're talking about things that do make you feel that way. And so if you have that traumatic reaction, if you have something like PTSD, you're living in a place where cues are everywhere. You have those triggers everywhere. The very house itself probably represents several traumatic events on a broad scale. And then there's probably these particular things, these smaller cues, like maybe a certain room of the house, maybe an object, maybe smells that are there, or sounds that specifically trigger you. You mentioned the door, knocking on the door. Maybe there's a certain creak or something that just brings you into that trauma and causes that intense emotion and the physical sensations. So you take that high level of baseline activation and then add on top of it all this work that needs to be done due to the hurricane damage, right? Again, I don't know how you feel about this house. Maybe you're like, fuck this house, I just want to be gone. But then you have to put in all this work to it, which feels unfair. Maybe you have a little bit more love for it than that, but either way, you're in a position where it's like you're struggling and you can't escape it because you have to stay there and try to get this done. So I don't blame you for feeling very stuck. And I'm saying all these things back to you, right? You know this stuff, but I'm saying it back to you so you can hear from my words just how fucking much it is. That's a lot. And you're not doing anything wrong by struggling. It's so much. And I'm sorry that you have to be in this situation. I think anybody would be in a tough spot if they were in your shoes. And right now it sounds like you're exposed like a raw nerve. It just is a lot to deal with, and you don't exactly know where to start because it's all so overwhelming. So in answering this, I'll do my best to help and give you some ideas, but please know that you're not struggling because something is inherently wrong with you, right? As I said, it would be extremely difficult for anybody in this situation. You mentioned that you're in therapy, but you've had a hard time telling your therapist how severe this issue is. And to me, that indicates that maybe you're carrying some shame or embarrassment for having these issues. On top of dealing with the issues themselves, you have that shame on top. A very common pattern. And I know it can be hard to be honest with your therapist. This is, again, something that's common. A lot of people have a hard time really being fully honest with their therapist because sometimes you just want to do a good job. You want to, show that you're trying hard. You don't want to be embarrassed by the fact that you're still struggling with things that you've talked about before over and over again, potentially. And there's also an avoidance factor. Traumatic reactions thrive on avoidance. Even though the triggers that you encounter are not signals of real danger, like I said before, your body doesn't really know the difference. And so in the past, your anxiety and your traumatic reactions may have actually kept you safe. There may have been something that you needed to avoid to keep yourself safe, and the hypervigilance that comes up from your anxiety, making you aware of everything, the physiological response to help you be able to escape, things like that are actually very functional. But now, when you're in this position where you are safe from those things that initially caused you the trauma, they still come up. And when they come up, your trauma, your anxiety will convince you that they're still there to keep you safe from something, even if that thing isn't actually dangerous. And so what do? You avoid it. You don't do that thing. And in doing so, you actually make that anxiety and the traumatic response bigger. It's like, see, I kept you safe. Keep feeding me and I'll keep you safe. So cracking open that avoidance and starting the process of approaching is absolutely the right instinct. It sounds like you understand that, but it all doesn't have to be at once. I think that there's often a fear of opening the floodgates and suddenly you're more of a wreck than you were before because you just can't pull things back together and you're completely unraveled. What I would suggest is not telling your therapist the full extent of what you're dealing with, but simply starting with telling them that you haven't been able to say everything. Literally, you can say, I want you to know there's more here than we've talked about. I've been really, really, really struggling, and it's hard for me to even scratch the surface. So I'll need your help with that. I do want to be able to talk about it, but I'm not there yet. And I just wanted you to know, like, you know some of this, but there's a lot more there, and I want it to come out in time. So just be aware of that. Right. And if you say something like that, your therapist should understand. They're not going to be offended. They're not going to be thinking that you're keeping things from them. It's a common thing, right? It's really hard to talk about some stuff in therapy, and it's normal for the story to evolve over time. And especially if your therapist has some experience working in trauma, like working with people who have had trauma, they're going to get it. If they don't work with people who have had trauma, that might be a good prompt to actually find somebody who does, because trauma therapy is not the same as your run-of-the-mill therapy, right? Having a provider who actually knows what they're doing makes all the difference. I see it very similarly to like an eating disorder specialist. Going to Joe Schmo psychotherapist for an eating disorder, you may not get the right kind of care there because you really have to understand what you're doing with that. Same with, say, somebody who may have autism who's trying to get therapy. Going to Joe Schmo psychotherapist, you may not get that sort of considerate care that you need. So finding somebody who knows what the hell they're doing, big deal. I've known a number of people who have worked with a therapist in the past who said, oh, I can do some EMDR. EMDR being the eye movement desensitization therapy that many people do for trauma. But they say that, and then I hear the story about this, and I'm like, that was not EMDR. They were just completely freaking winging it. And you don't want to do that when it comes to trauma, right? For any type of trauma therapy, EMDR or trauma-focused CBT or brain spotting, any of these approaches, there's a whole process. And normally that starts with teaching you coping skills, right? Getting you ready to face these things. So you have tools that you can use to keep yourself grounded, to keep yourself reasonably calm, and then identifying targets that are reasonable to work with, not things that are so severe they're going to cause you to fully panic or, just jump off the deep end into it. So it's systematic, right? If you need to find a different therapist, there is nothing wrong with that. Otherwise, like I said, just drop the hint. Say, okay, there's more to the story here. We need to keep working on it. And that's okay. If you feel confident that your therapist can provide you good support, totally fine. Sometimes even just acknowledging that there is more to the story helps to get that process started. I also don't think your situation is a matter of just pushing harder and trying and getting through it on your own. You really could use some help and some support in this situation. Again, anybody in your shoes would. So aside from therapy, have you thought about maybe medication? You didn't mention if you're on any medication or not, but in a situation like this, even temporarily, medication, there's no shame in considering it. You're held back by your psychiatric symptoms in a very real way. The way that the trauma is presenting, the anxiety, the grief, this is preventing you from really taking care of yourself. And they stop you from being able to move forward with your plans and just about the world in a comfortable way. And that's exactly what medications are meant for. They don't solve the underlying problems. They're not going to undo your trauma, but they can help you feel enough relief from your symptoms to start taking action. And there are various options here, from things like SSRIs or other kind of more typical antidepressants and anti-anxiety medications. Those will reduce the baseline level of anxiety and depression, and that can help you just, not feel as burdened by them. There are also medications that are maybe a little bit more sedating, like benzodiazepines, fast-acting medications that you can use when you're having those debilitating panic symptoms. If you're limited in your ability to leave your house, these days psychiatric medications can often be attained through telehealth visits, and there's absolutely nothing wrong with that. I'm also not sure what your financial situation is, but if you're able to recruit some additional help to address issues with the house rather than just trying to take all that burden on for yourself, that could also be a really good idea. That wouldn't really be a form of avoidance. This is just practical. You mentioned it's hard to even answer the door or have somebody over. So, this would definitely be its own form of exposure, having people come into the house and do work for you. But I think it could really be beneficial if you're able to. Essentially, what you're getting is some help to start approaching this monster rather than avoiding it, which is exactly what we want to focus on. You also mentioned that you made a friend who makes you feel safe and that you were able to tell her about what's going on. Totally amazing. Maybe you could ask her for some help too. It could be her coming over to help you organize things or get a few things done around the house, or she can just sit with you on the phone while you try to do some stuff on your own. Another tool that could be used to start approaching your trauma rather than avoiding it is one I talk about all the time, journaling. Journaling is great because it's on your own time, it's at your own pace, and you can use it as often as you want. One of the major limitations with therapy is the time frame. You get about an hour typically to open up a loop and try to close it enough for you to be functional back to your day. With journaling, you can start, you can stop. You can write for an hour straight or more if you want to, or you can just jot down some bullet points here and there whenever you're able to. So that's something that you can do. But you need to have some patience with yourself. Even though these are not new issues, you said that these are things you've essentially repressed for decades. And that means you're just getting started with this. Healing and moving through trauma, it can take time. And I know you don't feel like you have all the time in the world, and that's okay. There are some things that can be addressed right now, even if it's going to take time for that deeper healing to occur. So far we've covered getting more help, getting medications if you need it, having patience with yourself. Before we wrap up, let's talk about a few practical things, action-oriented. If you haven't yet, I would start by writing a list of all the things you need to accomplish in order to sell the house. And this will probably double as both a to-do list and an exposure exercise. I say this because it'll probably be overwhelming to actually acknowledge the nitty-gritty of what needs to get done. And doing so will bring up some of those cues, some of those memories we were talking about. And that's okay. Expect it to be daunting. Expect it to feel like too much. And for this particular list, I don't want you to really edit yourself. I don't want you to worry about qualifying how big or small a task is. Just grab a notepad or grab your computer or phone and go somewhere that's not your bedroom. That's important, right? We don't want to do this in your bedroom where you're feeling very stuck. Go sit at the kitchen table if there's one, or at a countertop, wherever, and just start listing things. It could be anything. Order new knobs for the cabinets. Call the junk hauling company to schedule a pickup. Gather the branches in the yard into a pile. Find matching paint for the exterior. Empty the garage out. Donate clothes, etc. Just get everything into one giant master list. This is not the list you're going to use to actually get things done, but this is you just putting your foot down and saying, okay, I'm not going to run from this anymore. It's scary as fuck, but I'm going to start addressing this and just putting those things down. Once you have that master list or some version of it, you can work on actually making some priorities. And to be clear, when I say a version of it, this master list isn't supposed to be another form of avoidance, right? There can be a temptation to say, oh, okay, I need to get this whole list done before I start actually doing anything. So let me keep working on it. Oh, but that's scary, so I'm not going to work on it. And then it just turns into its own ball of wax, and it gets scarier and bigger the more you let the task linger. No, just do what you can, right? Just have the intention of writing as much as you can, and then go from that. And then in the second phase, what you want to do is scan through this list and see if there's anything that you can handle quickly on your own. I'm talking things that are going to take 15 minutes or less. Right? So as you identify those, you can pull them out into another list. You can write them somewhere else, or you can highlight them, give them some sort of special way to recognize. And I'm not saying that these tasks are easy. I'm just saying that they have a small time commitment. So for example, sitting right here, I can see there are cobwebs around my windows here, behind the computer and the lights and stuff like that. And this would take all of maybe 1 minute, maybe 2 for me to go find the little tool to get them down and to do it. But I just haven't gotten it done, right? It's been hard to actually get myself to do it, but it's not actually physically difficult, right? So we start with these things. We start with these things that are going to take a few minutes. They're going to take less than a minute, and get some of those done. Then you're going to identify things that you will need to pour more time and preparation into. And then the things that you realistically need help with, right? So 3 tiers here. The immediate, I can knock some things out right now. The things that are going to take a little bit more preparation or a little more getting ready for it. And then the things that you need to bring in additional help for. And so once you have all of that, just start wherever you can. Make it a goal to cross something off the list, big or small, each day. If you cross off more than one, great. I would say never set a goal for yourself to do more than 3. If you do more than 3, totally fine, but don't hold yourself to that, because that might be discouraging and you don't need to do everything all at once. If you're on a roll, great, go with it. But just try to scratch off 1, 2, or 3 of those things every day. And the process of doing this is also, again, going to serve as an exposure exercise so that you're not running from your anxiety, and you're going to start building self-efficacy, that you can see yourself as somebody who gets stuff done, even in the context of a place that makes you feel a lot of mixed feelings. And there's some power to that. It's going to be sort of taking that power back for yourself. You absolutely can do this. I'm proud of you for recognizing where you are in this process. And I'm sorry that this is the stuff you have to deal with. But in months to a year, you could be in a very, very different place. So it's time to get to work. I believe in you. All right, so on to the second question. It reads, Dear Dr. Duff, I hope that you're well and apologize if you're not still taking questions. I just got into your podcast and really enjoy it. However, if you are, I have a question. I hope it's appropriate and hasn't been answered already. I've only gotten a few episodes in and have started with the oldest ones. I was diagnosed with PTSD a couple years ago and sometimes deal with strong emotional reactions in public. I was wondering if you had tips on getting over the embarrassment of explaining it to others. I know you're not supposed to be embarrassed about mental health conditions, but I am, and I can get myself to physically say the words, but I was wondering if you had advice for not feeling so awful afterward. I don't like feeling emotionally weak and out of control. Thank you for your question. And as I mentioned at the beginning, I am still taking questions and I could use more questions. So thank you for this one. You bring up a really good topic here, and I thought it fit well with the themes from the prior question regarding PTSD. So you're in a situation where you've become aware that you have PTSD, you got a diagnosis, and now you're in a situation where sometimes you have strong emotional reactions in public and you're left with shame and embarrassment about that. This is a common experience, and one that frequently leads people to develop some degree of agoraphobia, which is when you stop going to public places or leaving your house at all because you're afraid of having these strong symptoms with no way to escape. There are a couple things that could be helpful here. One is, rather than focusing so much on your self-judgments, you might try shifting your focus a little bit to others. You mentioned that you feel embarrassed, like you need to explain yourself and that you're weak and out of control. One emotion that's kind of incompatible with these or incongruent with these is the emotion of gratitude. It might sound weird, and I hope that you're not tuning out already, but focusing on gratitude can be an amazing tool for balancing out the shame feelings that you have. So for example, let's say that you're out in, public shopping area and you're triggered in some sort of way. You have a strong emotional reaction, you have some panic symptoms, and you're crying. So you sit down on a bench to gather yourself. You notice people looking at you, which would normally be a cue for you to feel shame, like you need to reassure all of them, like you need to explain yourself, and you assume that maybe they're judging you. Instead, try to notice the facial expressions of those people who maybe seem to be feeling empathetic. Maybe they're concerned about you. Maybe it's just like a little frown, a little brow furrow, like, poor thing. Maybe it's people stopping and checking on you. Anything like that. Try to notice that people are actually paying attention, but be grateful for that, right? Rather than only feeling embarrassed about it, try to recognize that there's something amazing, that there are people who give a shit enough to actually notice that you're having a hard time, rather than just, having their face buried in their phone or not really giving a shit. That can feel kind of rare in this day and age. So being grateful for that is one thing that you can do. And rather than feeling like you need to explain your symptoms away, you can focus on being immensely grateful that somebody cared enough to pay attention. Let's say somebody did stop by and they asked if you're okay. Rather than just explaining it away and saying, oh, yeah, no, it's just a thing. Don't worry about it. I'm good. Right? You could instead focus your attention toward gratitude and say something like, thank you so much for checking in on me. That's really sweet. That means a lot to me. I'm definitely going to be okay, but that helps. Thank you. Right? Just being very, very gracious about it. And I know it may sound dumb, but embracing incompatible emotions is really a strategy that does work. So that's one thing to think about, right? Just shifting the focus away from yourself and onto other people, but in a positive way. Another tip would be to work on the reactivity in general. I have no idea what kind of interventions you've done for your PTSD already, or if you're in therapy. There are a bunch of tools that are very helpful for becoming less reactive to your trauma triggers. Typically, the first step is to identify and practice some good grounding exercises. These can be physical things. They can be like relaxation exercises, like good diaphragmatic breathing exercises to induce that relaxation response. Basically, we're trying to shift your nervous system from the sympathetic, so fight or flight, to the parasympathetic, which is where that relaxation response is. That does take some training, though, some practice. It could also be like visualizing. A lot of people, when they're doing trauma work, visualize a safe space to put their thoughts and emotions in, right? Like a special box where you say, ooh, that's important. Let me put that in there and put it up on the shelf so I can get back to that later. Not so I could ignore it, but so I can put it somewhere until I'm ready for that. So things like that. There are other types of grounding exercises as well. Basically, you want to have your kind of buffet of options and the ones that you're familiar with so that you can gradually start to invite more stimulus for you to react to and master tolerating it. But you need those tools first so that you can regulate yourself. Some people benefit as well from putting themselves in situations where they have to cope with physical symptoms of panic, like, breathing through a small straw, like a little coffee straw, exerting themselves. So even just going to the gym or running, making themselves dizzy, different things like this where you're kind of mimicking some of the symptoms that you typically get from a panic attack, and then working through those and doing that in a controlled way where you're not going to be in the middle of public, you're not going to be driving, you're just in your own room or house, somewhere safe, and you can work through that and get more used to experiencing those things without being completely derailed. You can also work on the trauma side of it, so exposing yourself to triggers in a systematic and safe way, not just throwing yourself off the deep end like I said before, but in a systematic way. And obviously this is best done with a therapist, but you can also do a ton of work on your own as well. Again, you're not taking the full force of your triggers and re-traumatizing yourself. I'm talking about finding a level that's uncomfortable, but manageable, and starting from there. And the more time and effort you put into this, the more you're going to get out of it. So one safe strategy, for example, might be to think of the places that you normally get these overwhelming feelings and find a YouTube video that replicates them. So for example, there are great videos of people in coffee shops or at the mall, at a festival, on a train, in a restaurant, ones that are not like vlogs or like, hey channel, what's up chat, we're doing XYZ, but just, video with sound, watching things go by, and really giving you the sensation of being in that setting. And if that's enough to generate a little bit of stimulus for you, great, start there. If not, you can have that going and then also integrate in some of the thoughts or images or sounds or even videos that are related to the specific triggers that you have. Again, not in a way that's just going to open you up and really fully just bring about the strongest trauma symptoms, but a little bit. And this would allow you to practice tolerating these in safe spaces, right? In the comfort of your home or wherever it is you want to do this practice. And so you can get used to that so it's less jarring for you and less surprising to you when you're out and about in the world. Another type of thing that you can do and that you can work on is to talk about your experiences more. This is aside from individual therapy, but groups, whether they're therapy groups or support groups, are a really great place for this. Specifically, if you could find a trauma group where people have been through traumatic events, this would allow you to describe these incidences where you do feel embarrassed and have people understand exactly what you're talking about. Simply calling it out and getting some empathy for it can make a big difference, right? I think that the temptation is to really push it away and avoid it, but that's going to make it worse. I also want to say that there's absolutely nothing wrong with taking a pause when you're in a situation that causes a strong emotional reaction. For example, let's say that you are a student and you were in a classroom and you start feeling this big wave of emotion coming in and you're not going to be able to kind of keep a lid on it. You could slip out to the bathroom or just step outside and get some fresh air for a few moments and work through those emotions. There's absolutely nothing wrong with that. In fact, if you're able to do that and then come back to the situation that made you feel that in the first place, that's awesome. That's an extra bonus. It helps to break that feeling that you're ruining things by feeling emotion. Instead, it's like, hey, I can have emotion. Sometimes it's more than I can tolerate in that moment, but I can address it and come back, and that doesn't ruin everything. To share a personal anecdote, this is not completely related, but it reminded me of this. When I was in college, so back in the day, I trained mixed martial arts pretty heavily for a while. And primarily it was jiu-jitsu, which is like grappling, and Muay Thai, which is a form of boxing, kickboxing. And in the sparring for Muay Thai, I found that it actually made me cry pretty frequently. Not because like I was hurt so much that I just couldn't not cry. Like it wasn't unbearable pain, but something about the situation, maybe it's a little bit of frustration. I mean, I'm getting hit and kicked in the face and stuff. It just made it happen. Like I remember one time I was sparring with a partner in like a sparring class, and he's like, "Hey man, your eyes are watering a lot. Are you okay?" And I'm just like, tears streaming down my cheeks, like trying to spar, and like, yeah, man, I don't know what it is. I just cry. It just happens. You're good. Let's keep going. And other times I might have to take a little break. Like I'm like sobbing, like, yeah, I know. Okay, this is out of control. Let me get a hold of myself. I'll be back in a minute, So I'll just step outside in the fresh air, just get it out of my system, and then try again, come back to it. And there's nothing wrong with that. Like I wasn't any less respected at the gym for doing that. And honestly, acknowledging it rather than fighting it so hard makes it happen a bit less. Like once it's actually called out and you're like, yeah, that's true. All right, hold on. Yeah, I cry a lot. Anyways, let's get back to it. That kind of helps you not do it quite as much. So maybe you can find a similar strategy for yourself where you're able to approach this, you're able to do what you need to do to adapt, and then get back to what you were trying to do. Some of the advice I've given here is obviously a little bit vague because I don't know the exact details of your situation, but I hope that some of these thoughts are helpful for you. And again, you're not doing anything wrong. You have nothing to be ashamed about. That said, of course you're going to be ashamed. That's just the nature of it. And that's also okay, right? You're not doing anything wrong by feeling that shame. Just keep going. You got this. And with that, that's the end of the episode. Thank you guys so much for joining me. If you could, please rate and review the podcast on Apple Podcasts or Spotify, wherever you listen to it. If you're on YouTube, drop a comment down. Say hi. Let me know what you'd like me to talk about or what you enjoyed about this episode. And yeah, I'll see you for the next episode. Appreciate you guys.